I hope you guys are all doing well right now. I'm really excited to have this opportunity to present about a topic that I'm really interested in at this conference with a bunch of people who are like-minded like me. I know we're a little bit short on time, so I'm just going to jump right in now. So a little bit about me. My name is Kevina Wang. I'm a rising senior from Oakton High School, located in Fairfax, Virginia. Pictured here is me with my dog. Her name is Brownie, and she's a corgi, and she is the love of my life and the reason why I've been staying during quarantine. Some things that I love to do in my free time is I volunteer at my local hospital, and I've led a couple of projects for them. Here I just do like basic tasks like discharging patients and running gift shops, and I've led a holiday toy drive for them, as well as a COVID-19 card writing initiative. Something else I'm involved in is with Branch Out, which is a program that's dedicated to helping underprivileged students through volunteering and STEM education. It's something I love to do because I'm really interested in STEM, but also I realize I'm privileged when it comes to education and want to help those who are not as much. I'm also the founder of an organization called Heads Up Teens, which is dedicated to helping teens with their mental health. Mental health is the subject I'm really passionate about for personal reasons. I'm not going into detail here, but this organization is just dedicated to helping teens with their mental health. I'm also on my school's dance team, along with Lucy, who had a really great presentation earlier. We're on the same team, but we compete at nationals every year in Orlando, Florida, and perform at football and basketball games. I really love to dance, and it's something I hope to continue in college. For my future career plans, I'm really interested in science, medicine, business, and I want to be able to help others and make an impact. So I'm looking into possible careers as a psychiatrist, a healthcare administrator, or opening a private practice. But honestly, at this point, I'm still in the discovery process, which is why I'm excited to go to college in the future. Now that's definitely enough about me. Let's move on to the much more important part of my presentation. And today I want to talk to you guys about the silent killer. That's what a lot of people in society call this thing. It's an ongoing and worsening global health crisis where every single year it's getting worse and worse and more prevalent from generation to generation. The World Health Organization calls it the world's leading cause of disability, as it affects more than 264 million people worldwide and 20 million in the US alone. It's tragically related to 480,000 deaths annually globally and 30,000 deaths in the United States every single year. And what's the most scary part about this is that it's intangible and can't be seen. I can't see it, you can't see it, doctors with a microscope can't see it. In fact, you can't even sense it. It's not your typical illness that's physical, it's mental. And the silent killer is depression. Now, many of you guys have probably heard about depression before. It's a term that's commonly thrown around all over the place these days, with people saying, I'm literally so depressed, I have depression, things like that. But depression is a serious mental disorder that causes feelings of persistent sadness that are extreme and with little reason. It affects 7.1% of US adults and 13.3% of adolescents, as we are the most vulnerable population. And its symptoms include persistent sadness, irritability, loss of pleasure in activities, and the list goes on and on. Scientists aren't sure why depression occurs also, but it is a combination of biological, psychological, genetic, and environmental factors. But depression still remains a complex and perplexing disease we are yet to understand. Now, the global health crisis relating to depression that I want to talk about today is its rise. It's constantly rising from generation to generation, and it's becoming even worse rapidly during COVID-19. From 2005 to 2015, there was a 6% increase in millennial depression, as well as a 2% increase in self-harm. Further studies have further confirmed this, as a 2010 meta-analysis analyzing over 77,000 individuals from the years of 1938 to 2007 have shown that every single generation has increases in mental health disorders. This is an alarming trend. This graph right here further confirms this trend. As you can see, from 2006 to 2013, there's a 55.5% increase in the number of emergency department visits related to depression, anxiety, or stress reactions. So why exactly is this happening? Why is there such a rapid and consistent rise in the rates of depression? Well, depression is a disease of modernity, which means that as society deviates further and further from the human standard of being nomads, agriculture, natural things like that, and it turns more towards industrialization, modernization, consumerism, and growing competitiveness, mental health disorders have been getting worse and worse. Furthermore, people are now living alone, with more than 33% of adults living alone. Furthermore, we live in a world that's filled with chemicals. Chemicals like lead, methyl mercury, and more are proven to harm our development and therefore increase our risk of getting mental disorders. Furthermore, social media. Social media is a place that breeds low self-esteem and is hurting our mental health. Now, specifically during COVID-19, COVID-19 brings with it social isolation, fear, and many other different stressors. And what we have found so far is that there is a massive spike in the number of cases of depression. 49% of US men and women are beginning to show symptoms of depression. And while this doesn't mean they are necessarily diagnosed, that is an alarmingly high number, contrasted to the previous 7.1% of US adults, men and women, who have depression. Furthermore, healthcare workers who are at the front line of this pandemic and have been working in incredibly stressful situations where we need to show our gratitude to them more, 22.8% of them are showing signs of depression. And this is incredibly alarming because depression is a debilitating disorder that not only hurts the individual, but also hurts the economy and can lead to death. So what are the long-term impacts of COVID-19 on our mental health? Well, there currently isn't enough data to make a conclusive draw on this, but we can look at the data of past epidemics to see these trends and help guide our understanding. After the SARS epidemic, 15.6% of recovered patients had depressive episodes afterwards. SARS is also called a mental health catastrophe. After Ebola, 1 year after, 48% of those with Ebola had depression. And the fact that COVID-19 is on a much larger scale than these epidemics and is far more severe, it can almost be conclusively understood that COVID-19 is going to have tragic mental health impacts in the long run. So what can you do to help with this mental health crisis? The first step is to educate, not only yourself, but also other people. We as a society currently do not take depression seriously enough. We need to understand the severity of it. When other people are joking about it, just kindly remind them of this so we can work together as a society to break the stigma around mental health. Furthermore, know and look out for the symptoms by heart. If you are experiencing symptoms, reach out for help right away. And if you see symptoms in others, make sure you're there to support them and make sure to guide them towards the help that they need. Remember, symptoms include irritability, persistent sadness, sleep disruptions, inability to concentrate, loss of interest in activities, and much more. Furthermore, make sure to reach out. Check up on your friends and loved ones regularly. What's scary is that the nature of depression makes people hide away from the help that they need most. So what we need to do in order to combat this is to reach out to those that need help and not rely on them to come out themselves. On the other hand, if you find that you are the one who needs help, please do not hesitate to reach out. I've listed 3 crucial sources right here: the National Suicide Hotline, the Mental Health America Hotline, and the Crisis Text Line. Lastly, make sure to practice self-care. Now, what we think about when we say self-care right now is often doing things that are aesthetic, like bubble baths, putting on a face mask. But the thing is, self-care is not that. Self-care is doing things that are genuinely going to take care of yourself, which is practicing mindfulness, taking a break from social media, journaling, and just allowing yourself to do what you love. And maybe that means being a couch potato for a day. It's okay. Do what you need to take care of yourself. With that being said, that comes to the end of my presentation. And I want to thank all of you guys for listening and taking the time to listen to what I have to say today. I also want to thank my parents for supporting me in pursuing my different interests. And of course, the Global Health Leaders Conference for putting together this wonderful conference and giving us a platform to share. I'm sad that we couldn't have had this in person, but I'm still grateful to have this virtual platform to continue on. And if you have anything to ever say to me regarding my presentation, if you ever need to just reach out for help, feel free to contact me. My email is listed right there. I hope you guys are all doing well, and thank you for listening to me today.